Talking about some Facebook stuff this hour, and we'll start with Dr. Shieh and his most recent Facebook post. Bree?
Right. So Dr. Tom Shieh, he posted on his Facebook page, "Sometimes I feel so frustrated. Why do doctors, nurses have to ask for donations from the public to buy supplies for GMH? Don't get me wrong, I donate to GMH all the time. Right now, the people, are already suffering, lack of work, some lost their jobs, so please keep your money and use it for your own families, especially if you have kids. Our government is responsible for providing our doctors and nurses with the proper protective equipment and supplies to care for patients and to protect ourselves. Where is that stockpile? Many of us have asked, but zero answers. We need transparency. If there are no supplies from FEMA or Homeland Security, tell us so, or if there is, let us know. We don't buy duplicate supplies. That said, I will continue to do my best to help our island hospital, but those of you who need the money for your family, please do not donate. Keep it for you and your family. There is no shame for not donating. Those who can will, but we must hold GovGuam accountable for not providing the supplies. If we the people can buy them and donate to GMH, this means GovGuam should be able to buy them as well. Hoping tomorrow will be a better day for sun to shine through."
All right, 7 a.m. So on that note, let's bring Dr. Shieh up on here. Good morning, Dr. Shieh.
Morning. How are you?
We're doing okay.
Yeah, we're doing okay, but I'm just wondering here what it's going to be like for you at the hospital today when, people find out that you're saying don't donate to the hospital.
They're probably going to hate me for it. They'll probably get mad, but, that's the truth, Sometimes the truth is a little tough to swallow, but I heard the government received $117 million, so that's a lot of money. No matter what money we're going to raise, ain't going to come to even close to that. But what's frustrating, like I said in the Facebook, is that we've asked FEMA, we've asked Homeland Security, hey, where's the stockpile? During the pandemic meetings, you say, oh, don't worry, we got a stockpile. We have stockpiles ready for the pandemic. But when we ask, they go around, what do you need? What do you need? And then they say, oh, yeah, we don't have that in stock. Or I heard that there's containers that came in, but they don't want to tell us what they are or what is inside that containers. But, the fact is, it's the government's responsibility to provide these masks, equipment. And don't tell me that, they're out of supply, they can't buy it. Well, then how is the people buying it with their own money on the outside and giving it to GMH?
Right.
There's got to be vendors out there that does that. So, the excuses are there. But I think the key here is that I think if business want to donate, fine. Because business donate to hospitals all the time. It's okay. But I think the people right now, you hear, I hear, where's the stimulus checks? Where's the money? They're not working. They got to buy food for their kids. They got to put... Those people don't donate, please. But I think sometimes they feel the pressure to do so.
Right.
They feel the pressure to participate.
Doc, I heard a couple weeks ago there was something that one of the COVID response people, I don't know if it was the governor, Linda, or somebody had said that there was a stockpile of supplies at Public Health. This is before FEMA dropped them off. And I don't know if it was Estevez. So we've already burned through that, and then now we've got the ones from FEMA, right? There's a bunch of containers somewhere.
Well, I don't know if we burned through whatever they got. We never got accountable for any supplies. We've asked, what do you have? Let us know what you have. How many masks you have? How many gowns you have? How many hand sanitizers you have? Things like that we say, hey, let us know so we don't buy duplicate stuff. We want to help you, but you got to help us. If you don't tell us, don't be transparent, then, hey, if you got 2 boxes of cereal in the refrigerator, what is it going to... What am I going to do? Go out and buy you 5 boxes of cereal so you can feed your kids? Tell us what you have in the refrigerator.
Doc, you're not the only one who's been calling for transparency. You see that from the Guam legislature. Why do you think there is this lack of transparency going on?
I don't know. I can't answer that question. But, transparency is within the government system is good because if you want the people to follow you, you got to be transparent. And there's nothing wrong with being transparent. If you're going to give a contract to certain entities, be transparent about it. It's not this lack of transparency is the one that's going to get people upset, and you're going to lose trust in the people. And this is a pandemic. If you want to lead, you got to be transparent.
Mm-hmm. Well, you go to the Guam Memorial Hospital about it every single day.
Every day.
Every day. Are you seeing? What are people saying there? Are they experiencing a shortage of supplies?
We do. I get messages from Command Center all the time saying that, hey, we need masks, we need this, we need that. And we've asked, our doctors have asked, and I don't blame the doctors for asking. I don't blame the nurses for asking, because we do need those supplies. But, I think FEMA, who's here, and the declaration of emergency has been declared for, 2 months now? Homeland Security is supposed to have that stockpile. And when we ask them, they say, oh, yeah, let us know if you're short. Well, we are short. You don't have to. That's a given. You, the one, should be asking the GMH, what do you need? Not we should be asking
Or
you.
just maybe drop a load off over there, right? Hey, we just dropped some stuff in the front for you guys.
Keep that stockpile at GMH. Stop keeping it in a container where there's no aircon or whatever it is. But, it's very frustrating. So that's why I posted that. I'm also living alone, too, so sometimes in the middle of the night, I either cook a meal or I feel frustrated. I go, yeah, let me try to cook.
You're so frustrated, you're keeping your cereal in the fridge.
My cereal's gone. I was like, why is that? I ate them all. But, I think I don't know. I'm not a bad guy. I just want more transparency. That's all. And I think that's not too much to ask.
No, it's not. And I see that, with the public, again, I feel like we're doing our part. There's just so many efforts. You're right, where people are raising funds. They're trying to donate masks. They're trying to donate PPEs. I mean, there's a whole PPE Guam group that's raising money for these supplies. So the public's definitely doing their part. Even in something as the neighborhood watches, we're doing our part there. We're remaining vigilant. So we're all kind of doing our part, and we're just waiting for the government to get on our level, because we're killing that curve. We're staying home. We're following the orders, and it really seems like the people of Guam are working hard on this COVID, and it's just the government response is not really up there where we're at. But I mean, hey, someone's got to do the work around here.
Yeah, I think the people should be applauded for what they've done.
Nobody said thank you. Instead, we're getting chewed out by the governor, saying, we think she has a magic wand and she's just going to wave all the problems away. But, I mean, why don't you say thank you? Alakazam, Alakamalu, people of Guam, I just want to thank you.
I think people are more upset with, hey, you're alive.
How do you not thank us? I don't understand. How do you not thank us? How do you instead say that we should be grateful that we're alive because of you? It's really because of us. We stayed home.
I thank the people every day for staying home and staying strong. You know what I like to do, though, Chris? I don't think there should be people or the media should have to send any kind of freedom of information. And those are work, and it's tedious work to have to ask the government. The $117 million, what I'd like to see Adelup do is this. This is what we got, $117 million. Every dollar, every cent. Here's the list of vendors. Here's the list of whoever is getting the money. List them down and publish that. Be transparent. Don't make the media get a Freedom of Information Act.
We only get 2 questions. Work with us here. Come on. Don't make us waste our questions on transparency.
117 million. List them down. And whatever GovGuam has expended since the time of declaration of emergency, list it down.
Good luck with that. You got a FOIA that, Doc. Yeah. So I don't know, Bree, there's some kind of reporting they're supposed to do to the legislature, right?
Well, I think at the end, when there's a declaration of emergency that's declared.
Well, I'm going to send a FOIA this morning, Doc. And I know other media have tried to ask, and, they're probably just going to drown you in a, Alakazam, Alakaments, let's drown you in a mountain of documents and charge you a penny each.
Whoa,
it shouldn't be that way. A transparent government is a government that the people want. If a government cannot be transparent, how do you expect the people to follow you? Be transparent. That's my take on it.
I got you. Totally agree, Doc. Agree.
Yep, I agree.
Okay.
I wanted to ask you about the test results. There were a total of 84 test results that were returned over the weekend, and we had 0 cases of COVID-19. I wanted to get your take on it appears how well we're doing.
The virus has been on Guam, in my opinion, since April, or not April, since February. Way back in February. That's when I believe this virus came on board. Maybe even end of January. So it's been on Guam for a while. That's why the first case that came positive is already a community acquired. So that's evidence of community spread. Right from the get-go, when the first test is positive, community spread. So right there and there, we know it's already on Guam, okay? So the swiftness that we had to do with the lockdown, even though the governor, did a true lockdown or, short of that, a couple of weeks later, I think we've contained this virus enough that I think the positive is going to be on the lower side. So I think we've contained this virus here. The key here is how to get out of it. I think I heard Michael Israel, and I think Michael Israel is singing my tune now too, because I've been saying it all the time. Is that, hey, watch the hospitalization rate. It's been flat, which is good, and I commend the GMH staff for the ICU. Jolene Agan's done a wonderful job, and the ER staff, even urgent care. So I applaud them for that. So keep the hospitalizations low, but you have to watch the gates of the airport. If you're going to do any testing, test them at the airport, because that's where the virus is going to come in from. Locally, if you have some spread locally, as long as it's low, I think if you can keep hospitalization rate continue to be low, I think that's good. So I think we can start opening up certain businesses and then work with the community and how to live the way we're supposed to live now, not 6 months ago.
Right.
Social distancing, continue mask on, and if you have a restaurant, if you have a capacity of 100 in a restaurant, you may want to start with 10, and take reservations, things like that, and then making sure that you sanitize and continue to wear a mask.
Doc, I was wondering, because I was talking about this with some friends, when we open up the restaurants and we're going to do the social distancing 6 feet apart, I wonder who's going to have to wear the mask. Is it going to be the servers or the diners?
Everybody.
Everybody. So what do you do? Like, you go like that when you're eating, like...
Everybody. You're going to have to separate them out.
I mean, these are questions that they're thinking of. Hey, but Doc, just keep a heads up, because we have heard that the governor's recovery plan is going to be announced today. That's what we've got from, pending. Everyone's got to run it through and approve it and everything. But I think that's going to be their announcement today, and it could be why they took the weekend off from addressing the public and the media.
Well, I think whatever plan they come up with, I hope it's a good one, and I hope it's
no
realistic.
pressure, right?
Yeah, I hope it's realistic. Realistic meaning that don't give us these outrageous projections like 6,000 people is going to die, etc. Don't give it. There's no model that's going to fit. Now, if they refer to the federal government has said locally that you do what you can do locally, because the federal government does not know Guam. They don't know Georgia. They don't know Florida particularly. So they're going to base it on what you think locally is going to best fit your society, fit your community, and fit your businesses. Even with GHRA, our medical association is willing to work with them and see how we can, reopen these businesses on that side, because we all miss going out. We all miss going to restaurants. And I think the people have done a lot already. But we got to watch that second wave. Like I said, I think my interview at KUM, I was the first one to say, hey, these coming waves. If you look at some of the interviews that we did on the Zoom or Skype, it's coming waves. If you look back there, I said it way back. So the wave that's going to come, I think it's going to come from the airports. So you got to watch that. And the airport's going to go into community spread. So you got to watch that. I've always said testing should be done at the airport, GRMC, and GMH. So you got to watch that.
I wanted to follow up on something, because this is something you also said weeks ago, and that was the movement of the maternity ward, pregnant women out of GMH into the non-COVID hospital at GRMC. And then we heard Lillian Posada saying that, the priority is to get the adults, the Menumco, out of GMH into a non-COVID facility.
Right.
Have you heard any other discussion about this?
Well, I kind of gave up on that a little bit, because we've set up protocol now, and I got involved with that protocol, and I reviewed it. And I looked at the hospitalization rate at GMH, very low. If it stays low like that, I think GMH maternity ward labor is going to be fine. But again, I told Chris before, sarcastically, that, hey, I know we're going to be okay because the women and children is still at GMH, and that remains true.
Right.
So from that standpoint, I think the government Guam, they can talk all they want about surges, about projections, 1,000 dead. They can talk about all they want. The mother and children are still at GMH. But reality is, I don't think there's going to be a COVID-free hospital in Guam. Naval Hospital is not a COVID-free hospital, and GRMC had 2 cases. So really, if you really think about it, I think we've got over the hump. And I agree with Peter Lombard when he said we think we got over the hump. And we communicate daily, we chat daily. But I think right now, let's not go knocking on the doors and trying to wake up this virus. Stay home. Continue to do that if you're under the weather. Right. If you're really sick, call your doctor. Get some advice.
Doc, what about what the governor had said last week about conducting 258 tests a day? Did I hear that correctly, Bree? Because
yeah, when they
I
said
think
that,
I mean, it's making me question my own sanity, but I swear someone had said that we were going to conduct 258 tests a day last week.
Or that we would have the capability
Right.
to.
So
Yeah, I
actually,
know-
what
I
had
know.
happened was Linda and the governor came out and said that we're going to do 258 tests a day, and then the next day, Dr. Cabrera said, no. What they meant was we want to have the capacity to do. Well, if we want to have the capacity to do 258 tests a day, why are we still only doing 47?
Yeah, I think sometimes they just wing it. I think they're not communicating well, and the messages coming out from the very start it's always mixed. So that's why there's criticism
Yeah,
there.
and I also think that goes back to what Dr. Shieh, what you've been saying, is this transparency. Like, well, how many test kits do we have? How many of this? How many of that?
I'm just like, why would you tell us, the people of Guam, that you're going to test 258 people a day and then not do it?
Yeah, that's true.
I mean, it's
true.
kind of basic. I'm not calling anyone a liar, but you guys said you were going to test 258 people a day last week. Last week has come and gone. Was there any day last week where we tested 258 people a day? Was there?
No, but you know what I think is the reality here. Look at the military. I think they tested 4,000 to 5,000 sailors in 10 days, 10 to 14 days. They had the capacity, the capability, and I'm actually working on a letter to the admiral today. I'll probably email the admiral today and say, hey, sir, if we can get your help here because you've tested. Congratulations. You moved swiftly. You've done it. You've tested 5,000 sailors within 2-week period. How about helping the island now? Because we've helped you accommodate your sailors, our United States servicemen, into our community. It's time. Don't wait for the governor to ask you, because I think the governor said, hey, if we need your help, we'll ask. Well, listen, you didn't ask. I'm going to ask.
Yeah.
I'm going to write a letter to the admiral today, and I'm going to ask him, hey, help us test 5,000 people if you want to do that. Chris, the reality is here, okay? If you want to test 258 people, go to the hospital, go to the airports. If you're going to knock on doors, swab them at the door. Don't tell them to come back out and swab them. Do it right. I don't mind testing. I think testing is good. It's not a bad thing. But if you're going to waste the resources on that, don't have more people staffing your tents and less patients coming out to test. That's not the way to do it.
Yeah, we got to capitalize. I mean, if we're gonna be making a big deal about how we're so cozy with the Admiral, and we did our part. We helped out with the TR. I really think that. I think with the Admiral, it said that when basically, this is oversimplification, he said when it gets really bad, we're here as the backstop. And I think the line of thinking should be, let's try and get your help maybe before it gets really bad.
Yeah, come on, they tested it. Thousands of sailors here. If they have the capability to do that, this is war, right? We always say it, and I was the first one to say, hey, this is war.
Yeah, don't wait till we're losing the war to come in.
I'm like, I said that since the very beginning, back in February and early March, this is a war. Now, if this is a war, then hey, let's get the military to help us out. And the admiral is a smart guy, okay? He's gonna always say, well, GovGuam didn't ask us to help you guys test. You GovGuam is doing it yourself. It's great. And I read the letter from the admiral to the legislature. I don't know if you read it. Was dated April 23rd. The admiral wrote to the legislature and just said that, hey, you guys are doing it already. Well, we need to ask him. Hey, give us 5,000 tests. You've done 5,000 for your sailors. Give us 5,000 tests for the community.
Yeah, and I think
that can be done.
I think that they should ask him at the press conference. I don't know. Either put him on the spot.
He's going to say, what he's going to say? Well, you didn't ask. You're doing it already.
Yeah.
Right?
Okay, Doc.
I'm not in charge.
You need a little magic wand, Doc?
Give him a little spell.
Let's give you a little spell, okay? Alakazam, Alakamalard.
I can tell you this, Chris. I don't believe those big surges, about thousands of deaths. I can tell you this, okay? A lot of my patients are getting pregnant again. So I can predict, come January, you're going to have a lot of babies. December, January, February. I can bet you that. Okay, the surge is going to come, and that's going to be big.
That's the surge you're talking about.
Okay. You're going to be extremely busy then.
Right, Doc. Okay.
All right.
Thank you, Dr. Shieh.
Take care.
Wash your hands.
Of course.
Okay. There you go, Dr. Tom Shieh. Always interesting to hear what he has to say, and he definitely has a lot of stuff to say.
Mm-hmm. And you know what? And now's the time I want to remind everybody that the government has moved into their expanded testing, and so anybody that is feeling sick, having these COVID symptoms,